All right. So, hello everyone. A warm welcome to all of you who could join us today. On behalf of the Asia Foundation and Core Global, I am Faisal, the country representative of the Asia Foundation in Bangladesh. I'm mindful that this is a month of fasting for many of you across the world. So, Ramadan Mubarak to those who follow. Today's program is mainly divided into two segments. In the first section, I will be going through with my colleagues through the presentation and the study findings and etc. And in the second section is more exciting, where Dr. Rebecca Calder, my colleague from Core Global, will be hosting a moderated section with the esteemed panelists. But before I begin, let me go through some housekeeping rules. Please keep yourself on mute when not speaking. The event is 90 minutes long and will be recorded for post-event release. We will be monitoring the chat function throughout the session and encourage you to use it generously. So there will be someone monitoring the chat section, and we'll be trying to organize among ourselves to answer your questions. If you would like to enable live translation, you can enable that by clicking on CC transcription. So closed caption transcription is also available for this program. So let me start with saying a few things about today's presentation. It is part of a work stream between Australian government's DFAT and the Asia Foundation, where we were basically looking into inclusive urban governance. The part of that program is we decided to look into the effect of COVID-19 into complexity of urban economy and the negative or positive impact that it had on people's life and livelihood across 8 cities in Asia. So this report jointly was published, but there will be countrywide publications coming soon. And we are very hopeful, and we will be very grateful for your feedback and comments today to take it along to the next level of discussion and publication. So we'll be consulting on the findings and try to get as much feedback as possible. So as I mentioned, this is DFAT supporters. So we are very grateful to the Australian government and people, and we are very fortunate to have the Deputy High Commissioner of Bangladesh High Commission of Australia, Ms. Nadia Simpson, is with us. So Excellency, at this point, may I ask you to give us a few opening remarks. Thank you very much.
Thank you very much, Faisal, for that warm introduction and for the invitation to join this event. I'll keep my opening remarks brief, as I, like most on the line, are particularly interested in learning more about both the paper and the broader issue of urban inequality in our region, and particularly with a focus on recovery. I'd like to use the time I have to highlight the reasons why the Australian government places particular value on the strategic partnership it has with the Asia Foundation and why this work is so important. Australia and the Asia Foundation both highly value the deep and long-running strategic partnership that we have held for many years. In particular, its networks, its knowledge and expertise, and genuine approach to partnering for effective growth and development. The strategic partnership itself has facilitated over 128 million Australian dollars worth of cooperation from 2017 until now, all across Asia and increasingly in the Pacific. The current phase has 5 priority work streams: cooperation in advanced middle income countries, engaging emerging Asian donors, inclusive urban governance, under which this work sits, technology and the future of work, conflict and fragility. This research of the report that will be presented today is an excellent example of the core purpose of that partnership: to provide high quality information, analysis and tools that contribute to Australia's effectiveness in responding to change, implementing partnerships for recovery, and to the Asia Foundation's priority in the region. It brings together in very specific and tangible ways issues of central concern to namely women and gender equality, COVID-19 recovery, equitable resource sharing, inclusive economic resilience in our Indo-Pacific region. We stand to gain an enormous amount from listening and learning but more importantly, to sharing perspectives and applying it to our work. I took up my posting in Bangladesh in December 2020, in the middle of COVID. We all have our own stories of loss and the challenges we have faced over the past few years. I'd just like to take a moment to acknowledge the loss suffered by those on the line and to remember those who are no longer with us. From a South Asian perspective, it was a year ago that we looked in horror as the Delta wave emerged in India. In a globalized world, one of the themes that initially came out of the pandemic narrative was that this illness affects everyone, rich and poor, in developed countries and in developing countries. Like climate change, it was seen as something that could spur us all to collective action for a global good. You often heard the phrase, we're all in the same boat now. One of the best phrases I heard over the past few years in response to that empathetic refrain of solidarity was, we're not all in the same boat. We're in the same storm, but we're all in different boats. We all know that inequality and deprivation exacerbate the impacts of what people perceive as a common experience. I look forward to learning more about the study's findings and the discussion to follow. Thank you.
Thank you so much for your speech, Ms. Simpson. It's been very insightful. So with that, I think we can move to some of the findings, and we have 3 colleagues from Asia Foundation and Core Global, who will be presenting a few findings and also give their insights on the report. So we have Dr. Rebecca Calder from Core Global, Sumaya Saluza from the Asia Foundation, and Kaliun Bolbutter, if I pronounce the name correctly, from Mongolia, from our Mongolia office. And over to you, Rebecca.
Thank you so much, Faisal. It's lovely to be here with you all, and I very much appreciate the invitation. If we could have the slides brought up. Thank you so much, Miranda. Wonderful. So I'll be providing a short overview of the research work that we undertook over the past 2 years to understand the impact of COVID-19 on women and marginalized groups in Asian cities. Next slide, please. The Asia Foundation and Core Global began this work in response to the pandemic, and we started in April 2020. We wanted to use the pandemic as an opportunity both to further existing calls to address power hierarchies and disparities between international and often Western researchers and local researchers from the Global South, and also to deepen our understanding of the pandemic's effects on disadvantaged urban communities, especially women. Next slide, please. Following some background research and a consultation with DFAT, we started with a big, audacious research question. What is the current and likely future impact of the COVID pandemic on inequalities in Asian cities? We began by piloting a qualitative research course with 19 Asia Foundation staff from 10 countries in order to ground potential researchers in qualitative research methods. By October 2020, we brought on board 10 brilliant local researchers from 5 countries to lead their own research studies. Each research team was paired with a mentor who provided guidance through the course of the research process. The findings of our regional report draw on a total of 80 interviews that were conducted between October 2020 and April 2021 across 8 cities in 5 Asian countries. The focus of each study was selected by the research teams themselves. For example, in Hyderabad, Pakistan, the research focused on the experience of female Bengal workers, while in Laos, the team documented the experiences of recently laid off workers from the tourism industry. Next slide, please. Thank you. In order to enable regional comparisons, the Asia Foundation and Core Global developed a framework to guide the research and to explore the immediate and long-term impacts of COVID-19 on disadvantaged groups. We wanted to acknowledge that inequality takes various forms and goes beyond income or wealth, and that there are a multitude of intersecting factors at play with inequality. We were interested in building a more nuanced and grounded understanding of inequality as experienced by people and across a range of different levels at the household level, the market, the national level. So we wanted to see context as multifaceted. We included thinking on the various forms of capital that people need to achieve a range of well-being outcomes. So not just economic and financial capital, but also human, social, and political capital. Finally, this led us to include the concept of capabilities, a concern ultimately with what people are able to be and do, and with very much of a sort of a future focus. Over the next few slides, my colleague Samaya will share some of our high-level findings that will also better illustrate the application of the framework that you see on the screen there. So Samaya, over to you now.
Thanks, Rebecca. Okay, I'll go through this fairly quickly. So what we did was we started with context, and we started with noting inequalities that existed in urban economies and governance even prior to when the pandemic hit. For example, a large proportion of urban workers worked in the informal economy, often in insecure, poorly paid, and hazardous conditions. On the other hand, pre-existing gender inequalities also meant that women were undertaking a disproportionate amount of domestic and care work, often juggling these with paid jobs or business ownership. Outside the home, female micro enterprise owners tended to be smaller in size, have lower access to loans and lower savings. In 2020, therefore, efforts to control the infection spread had an immediate and sharp impact both on the market, but also for care responsibilities within the house. Next slide, please. The informal nature of the market also meant that workers could be dismissed or have their hours reduced without adequate notice or compensation. This impact was particularly acute for households with prior debt and low savings, who saw their financial capital depleting rapidly, forcing some to make really difficult choices between essential purchases. Next slide. In response, and we came back to context, many governments did respond by initiating a range of measures to alleviate the financial and at times social impact of the pandemic. Can move on to the next slide. However, for us in our research, it was social capital that most relied on. For example, working mothers in Mongolia relied on grandparents to take care of their children once schools shut down. Laid off tourism workers relied on friends and family to find alternative employment. The few female Bengal workers we spoke to in Hyderabad, Pakistan, who were able to access the cash assistance program, attributed it to support from neighbors or relatives. But relying on social capital could only go so far. People describe being extremely and constantly stressed about their own financial standing, the education and future of their children, the health of their family members, among a range of other concerns. With more family members spending greater time at home, more female respondents shared that they were completely exhausted. The increased time poverty and mobility restrictions meant that many felt a sense of isolation and a weakening of social bonds as they were unable to receive or offer help as they would have done so prior to the pandemic. Next slide. This meant that people found it difficult to recover when restrictions eased. And even when we spoke to everyone before, and our interviews ended before the Delta strain actually hit, many were already struggling to bounce back. For some, the first lockdown itself was enough to exhaust all their savings. Given the length of the pandemic, it's likely that many urban residents are in a more precarious position today and less able to respond to ongoing or future shocks. This led us to start thinking about what do we need to do when looking ahead. Our recommendations note that there is a high likelihood that the pandemic's impacts have continued to intensify and therefore resulted in a further depletion of capital. What is clear is, and this was highlighted by Nadia as well, that the pandemic has had a disproportionate effect on marginalized groups in urban areas. Women, ethnic minority workers, those working in the informal economy, and other disadvantaged groups have faced a lack of job security, decreased income, limited access to support from government measures, all while increasing and feeling an additional burden of care responsibilities. For women, especially, challenges have compounded in these contexts, increasingly depriving them of their agency, autonomy, and independence. We don't expect the recovery to either be linear or immediate, but there is a substantial risk that all recovery efforts will either gloss over or perpetuate current and deepening inequalities. And therefore, supporting an equitable recovery becomes even more important. And for us, that starts first by using metrics that capture the impact of the pandemic in how it was experienced by individuals and households as a whole, as opposed to an over-reliance on financial indicators. In the short term, there is a need to continue intentionally expanding access to existing services and refocusing recovery efforts to those who are most marginalized and impacted. In the medium and long term, there needs to be work done with urban workers to ensure they are better protected and can rely on safety nets, while also enhancing their bargaining power and building their political capital. And finally, there is a need to address and redistribute work in the care economy and transform gender norms that govern division of labor within the household. This is a really quick overview. Miranda has already shared our detailed report. We also have a 2-page brief, which Miranda will be sharing. And then we will be continuing to disseminate the individual country reports. But we wanted to give everyone a snapshot of what that looked like. So I will hand over to my colleague, Kaliun, who was part of our research team in Mongolia. Thank you, everyone.
Okay, thank you. So hello, I hope you can see my screen now. So it is my pleasure to share with you about our research on behalf of our team here in the Asia Foundation Mongolia office, including myself and Olga, who's present here, and the 2 other colleagues. So our research was developed towards the beginning of the pandemic with the view to capture the different ways in which the pandemic and intermittent lockdown measures had impacted women's well-being and ability to participate in paid work. Despite some government actions, the pandemic led to dire consequences for women in many aspects for their lives, both professionally and personally. So in response, our team here at the Asia Foundation Mongolia office, we really wanted to focus on our research to understand the impact of the pandemic on working mothers living in Ulaanbaatar. And we particularly were interested in how the pandemic and related measures to curtail its spread impacted the well-being of mothers and what coping mechanisms they had in response. Excuse me. So we collected data between January and February 2021, and during this period, we conducted a total of 16 interviews with an equal number of working mothers in private and public sector. And we included women who had been able to continue work and those who had to stop work during the pandemic. While we collected a rich amount of data, we wanted to focus on the varying experiences of women working in private versus public sector and where women found it very hardest to cope with. To begin with, and understandably, the pandemic impacted individuals differently. Broadly, women working in the public sector felt they could not avail of work from home options, and actually they reported that the workload rose as the government scaled the response to the pandemic. On the other hand, for working mothers in the private sector who could work from home they felt that they were not being, they didn't have an equipment for them to be able to work from home. For example, they were not provided with the essential tools such as laptops or desks or internet. Also, some mothers did not opt for working from home options as they felt pressure to continue to demonstrate their worth in the office as businesses started to downsize due to pandemic. For women working in the service sector, work from home wasn't an option they could avail of. A common thread across the interviewees was the lack of viable and sustainable childcare options. With increased workloads and closure of schools, working mothers felt an acute strain on their time and care responsibilities. For most, it was impossible to work and take care of the children who were studying at home at the time. Most, if not all, relied on their immediate family members, usually a single parent, who then took on childcare responsibilities. And for many mothers, the continued reliance on grandparents, while welcome, felt unsustainable and insecure. In few cases, societal pressures further distressed working mothers as they felt they had to negotiate increased judgment for not fulfilling their responsibilities as a primary caregiver. While we conclude by noting the needs that remained unaddressed and were likely to have had knock-on effect, and would then invite you to reflect on how these needs could possibly have been addressed and what are the measures and systems we could put in place now to better address these unmet needs. To conclude, in overall, government measures were appreciated by all our respondents, but however, they did fall short in practice. For instance, many working mothers could not accept provision of flexible working hours either because of increased workloads or increased pressure to demonstrate their worth, or that employers did not grant these working options despite the government decision. And secondly, measures such as tax exemptions did a little alleviate the burden felt by working mothers in public sector and those working in small businesses or in informal economy. Finally, disruptions to the midday meal was a large lens from which the school closure measures were understood. In response, the government provided cash assistance. However, these were little acknowledgement of the impact these measures had on families' care responsibilities, particularly for women. And that's it. Thank you very much for your attention.
Thank you, everyone, for your great presentation. Just to remind everyone that there is a chat function available, and there will be also a Q&A session towards the end of the program. So please feel free to type in your question, or maybe in the Q&A session, raise your hand. For now, I'm very excited to hand it over to Rebecca, my colleague from Cori Global, to moderate the next session, which is where we have 3 panelists. We'll be discussing various aspects related to urban inequality and inclusive urban governance. Just as an introduction, Dr. Calder is a feminist anthropologist by training and has nearly 30 years of policy and field experience on promoting gender and inclusion across Asia, Africa, and the Pacific. Rebecca has extensive knowledge of key concepts, frameworks, approaches, and evidence of what works to achieve empowerment and recognized expertise in designing and leading innovative qualitative research and designing and leading complex evaluation. So you can understand how exciting this moderated session is going to be. So Rebecca, over to you.
Thank you so much, Faisal. Much more exciting than me is our 3 panelists who I would like to introduce to you all now. We're very fortunate to have Dr. Iona Dutta, who is a professor in human geography in University College London. Her research interests lie in the politics of urban transformations in the Global South, with a particular focus on post-colonial urbanism, smart cities, gender citizenship, and regional futures. She's authored The Illegal City, Space, Law, and Gender in a Delhi squatter settlement in 2012 and is published in over 60 peer-reviewed journals. Thank you for joining us, Dr. Datta. We also have with us Mr. Miguel Musni, who is a senior officer in the Poverty Eradication and Gender Division, Human Development Directorate, ASEAN Sociocultural Community Department in the ASEAN Secretariat. Mr. Musni supports the development and implementation of the ASEAN Gender Mainstreaming Framework and the development of ASEAN reports, such as the ASEAN Gender Outlook, Achieving the SDGs for All, Leaving No Woman or Girl Behind, jointly with UN Women, and addressing unpaid care work in ASEAN, jointly with UN ESCAP. Thank you for joining us, Mr. Musni. We finally, we have, last but not least, Dr. Mirza Hassan, who is a political economist and the head of the Governance and Politics Cluster of BIGD at BRAC University. Dr. Hassan's research largely focuses on political development, state-business relations, urban governance, and local governance, the justice sector, and human rights, as well as a range of related issues. His work focuses in South Asia, the Pacific, and North Africa. So a warm welcome to all of our distinguished panelists. We're thrilled to have you here. We've got 2 rounds of questions that I'd like to take before we open it to the participants to ask questions. I'd like to start with some questions that focus on sort of where are we now and what have we learned? And I'd like to ask each panelist to respond to one question, taking about 5 minutes. I've got the first question for Dr. Datta. I'm wondering, could you please tell us more about the impact of the pandemic on social infrastructure? We heard quite a bit about this from Kalyun Balbatar from the TAF Mongolia research around the stresses and strains to the social infrastructure. So could you speak to this a little bit more broadly and how this relates to deepening inequalities?
Sure, thanks first of all for inviting me to this workshop and putting me on this panel. It's a really exciting event, so I've been looking forward to this. So my work, particularly as you suggested, Rebecca, has been around post-colonial urbanism, particularly in the areas of India. And I've been looking at particularly gender citizenship and the ways that urban inequalities impacts on gender and intersectional identities. Infrastructure has been a very important part of this because obviously infrastructure creates particular potentialities for inequalities. Differential access particularly will lead to specific social groups, specific marginalized social groups receiving basic infrastructure like water, housing, sanitation, and so on, or not. So obviously infrastructure has its relationship also to time and space, in what times of the day, what times of the year. For example, monsoon periods, infrastructure is particularly stressed. So the way that I've been addressing this or focusing on this in terms of my research work has been to look at the way that for the poor, infrastructure, access to infrastructure is actually about survival. And so we try to tend to think about this as for marginalized groups, infrastructure is survival infrastructure. And survival infrastructure is sort of a network of many different things. It's physical infrastructure, but it's also the social infrastructure. And then very recently, as we realized in the pandemic, the very important rising significance of digital infrastructure. And it's a combination of all of this that then presents the opportunities or potentialities for increasing marginalization across time and space. So I just, without taking too much time, I just want to give a summary of some of the work that we've been doing, particularly in India and with young urban women, but particularly young urban women who live in slums and informal settlements. And so they have a kind of a paradox in their lives, in that they have much higher aspiration than the earlier generation. They don't want to be domestic workers. They don't want to be laborers. They're better educated, and yet they are stuck in service sector work, very precarious work, very kind of temporal work. But at the same time, they are digitally more savvy. They all have mobile phones. They are able to use mobile phones to communicate and get access to all the information that was being provided by the state during lockdown, and yet they are left behind because they don't have
the economic capacity to pay for mobile phone data and so on. So I'll just maybe summarize two very important impacts of the pandemic in two very different spaces. So one was the space of the home, and this is already very well articulated by your report, which I read with great interest. So the home became the space of increased attention, increased significance, but also increasing conflict. The home also suggested the importance and the rising significance of what is digital infrastructure and how digital and social infrastructure come together to provide particular modes of survival at particular points of the lockdown. The first thing that happened in the home was that mobile phone data was forfeited, because that was kind of a luxury that they were being able to afford before the pandemic hit. And because mobile phone data was forfeited or highly minimized, it had a very differential impact on women, because they were the last in the range of priority to have access to mobile phones. And that, of course, impacted on education. It impacted on the kind of time they had to communicate, the kind of social friendships, the social capital, so to speak. It had a very important impact on that. And it had an impact on care as well, the gendered care roles, because then women became very focused on the care aspect of their household, had less education opportunities, and then of course the men had the priority for access to care and communication. Access to communication. So digital infrastructure both aided and abetted a differential access between family members. So it's not just across the city, it's actually within the family you see highly striated access to empowerment or disempowerment. And we ran a set of podcast workshops with these women who were stuck in the home under these very impossible conditions of work from home, which they couldn't do. And four important things were said to us. One was the question of time and temporality, that in a way time seems to have stood still, but also time was really greatly in demand. I mean, they were really running short of time because of the extra work they had to do at home. Education, that I've already mentioned, was very, very fraught, particularly for women, because the men had, their brothers would have the mobile phone to attend the Zoom sessions, and they would be then cooking food. Marriage became a very important aspect of it. And marriage was an interesting thing because it's always been a point of conflict with, not conflict or tension, rather, with the family. But this was a time that young women were stuck at home doing nothing, within quotes. And so the parents thought this was the time that they should be getting married. So that became an increased source of tension and anxiety and stress for some of these young women who didn't want to get married and wanted to continue their education. And finally, the fourth thing they identify was clothes, which is kind of a banal thing, but clothes became important because you're, again, under high surveillance by family members, and what clothes you wear, how you conduct yourself within the family, within the space of the family, became even more fraught with tension. The second point, the second impact is a kind of a different scale. The second impact was on the impact in India's smaller towns and cities, the tier 2 and tier 3 towns and cities. The bigger metropolitan centers could take bigger shocks. The smaller towns and centers could not take these shocks because they already had very poor infrastructure, low access to water, sanitation, housing, etc. Governance was sort of, kind of chugging along, not always perfect, broken in many ways. Planning had a lot of challenges. So when the lockdown happened and the migrants began to return from big metropolitan cities to the smaller towns and centers, they first of all carried the disease back with them. But second of all, these smaller towns and centers did not have the health infrastructure to cope with the pandemic that was brought into these smaller towns and cities. And then, of course, that impacted on the home and the care infrastructure and so on and so forth. And so these second tier cities, the smaller towns and cities, have always been unequal partners in India's urbanization. They've always lost out on some of the bigger investments that have been made in the bigger cities. And this really was the trigger point in which you actually laid bare the difficulties and the challenges that these smaller towns and cities have always been facing. poor public health, poor governance, poor planning, and they really showed the deficits that were there in the basic social, physical, and digital infrastructures. So, I mean, in terms of kind of broadly summarizing, I would say it not only brought together new stresses and new triggers, but actually the earlier stresses and triggers that were there were pronounced. And so what we saw was a kind of a cumulative sense of violence that had been there for generations in these smaller towns and cities, but also the accumulative sense of violence that had been there in the sense of family as a social institution, working through surveillance and control within the home became even more stressed and even more acute at that time. So I'll leave it at that and let others join in.
Oh gosh, I think we could listen to you for many more hours. So there were so many gems there, you know, and so many things that I think resonated, you know, beyond India as well. You know, some common experiences that those who are listening will think, yeah, that resonates with some of the things that I have experienced or that I've read research on in my country context. So thank you for that. That was brilliant. And I'll ask Mr. Musni now. How do you feel that responses to the COVID pandemic have placed additional care burdens on urban residents? I'm thinking, given that many of these urban residents are already dislocated from their communities or extended families, can you speak to any of the gendered aspects of these additional care burdens on urban residents?
Yeah, thank you, Dr. Rebecca. And before I start, I'd like to thank the organizers for inviting the ASEAN Secretariat and give our some information and share our thoughts during this panel discussion. Now, going back to your question, maybe just to preface the information that I will share, these are all based on data and information that we have gathered and we have read and compiled among the 10 ASEAN member states within the ASEAN region. And I think most of these findings also resonate and echo what Dr. Datta mentioned earlier. So based on what we've gathered at the onset of the pandemic, the ASEAN member states immediately responded by expanding and implementing targeted social protection measures that looked into supporting households and also included targeting women and children, fully recognizing their vulnerable situation because of the pandemic. But as the pandemic unraveled, there was an observed, of course, decrease in the number of hours that women and men were employed, which caused and impacted their livelihoods. But also we saw a spike in the reported cases of domestic abuse and abuse and violence in the household. And I think this goes back to what Professor Datta mentioned earlier about common spaces in the household being shared. And it was very unfortunate and somewhat disconcerting that the victims shared common spaces with their perpetrators. And so we saw that during the pandemic. And we also saw that because of because of the restrictions in the movements and also everybody crammed in the spaces in the households, there was a sharp increase in the incidence of unpaid care work shouldered by women and girls in the household. So we have data supporting and showing really this increase in the incidence of unpaid care work. Now, also going back to what Professor Datta said, we also saw that there was when movement restrictions eased, we saw movement between urban and rural spaces, which caused a sort of threat because people moving from urban to rural spaces would be bringing their some risks with them. But what we also saw in the region is that there was a decrease in the flow of remittances from migrant workers, which also impacted urban spaces, urban residents, and rural residents. The way I'm presenting all of these insights is giving due recognition between urban and rural spaces, because in the region, we see this inequality between such spaces. And within urban settings itself, there are a lot of inequalities. No? And maybe I can go to the next part of the question, no? And highlight just some gender aspects. No? One is when the COVID, when the pandemic hit, it was really quite obvious that the sectors hit in the region, in the ASEAN region, were the tourism sectors and manufacturing sector, and I think to a certain extent the service sector. And in these sectors, there's a predominance or overrepresentation of women. So their means of livelihood were indeed impacted. And on top of that, these women in urban settings already experience a high degree of informality, meaning they have less access to social protection, pension support, etc. No? And compounding that is the gender gap, the wage gap, I mean, between men and women. So really, it compounded, the pandemic compounded a lot of these inequalities that have already been existing. Now, the second gender aspect I want to highlight is the intensification of vulnerabilities. Professor Data alluded to this earlier on marriage, but in the region, what we saw is a greater tendency for child marriage to increase. And this is something that we're still monitoring right now in the region. Child marriage as a coping mechanism from the pandemic. And this is something that ASEAN is looking into and really monitoring. And the other one I've already mentioned is on informality. Now, the last point I wanted to share, Dr. Rebecca, and with everyone is when we look at gender aspects, when we look at women impacted by the pandemic, no, and in the urban setting in particular, we're not just talking about one monolithic group of people. No, what we saw in the region is that we wanted to look at data reflecting what's the status of older women and older women in advanced stage of their lives, because in the region, in the ASEAN region, we have data indicating that women outlive their male counterparts, women live longer, and in their advanced stage, there's more demands for long-term care, palliative care, and all of these have been impacted again by the pandemic. No? And we're also looking at women with disabilities having access to health services, which have been, again, adversely affected by restriction movements and being in isolation, and also single mothers providing for their children. And I think one of the last points that Professor Data mentioned is on young women. In the region, apart from having an old or an aging society, we also have robust young segment of society, no? And we're really looking at young women being engaged in the gig economy and in having access to technology. And I guess that's a positive note to end on with my presentation or sharing of information in this discussion. That's all, Dr. Rebecca. I'll hand over the microphone to you. Thank you.
Thank you. That was another treasure trove, and it's so heartening to hear the ASEAN Secretariat's focus on collecting sort of intersectional data, beyond gender, and looking at issues around age and ability and other issues, because that is so sparse in the Asia Pacific, particularly the Pacific, and it's so needed for us to understand the experiences of different groups. And then to craft appropriate policy and programmatic responses to those. So that was brilliant, and so many synergies between what you've both spoken about, Dr. Datta and Mr. Musni. And now I'm going to move to the last question for this round for Dr. Hassan. Could you speak to us about what has remained invisible or continues to be missed around the impact of COVID on deepening inequalities? A lot of these things that we're aware of around, increased unpaid care burdens, the increase in violence and other social ills such as early marriage, what are the things that you think we might be missing, or they're on the radar but not as firmly on the radar, and we need to pay more attention to?
Thank you, Dr. Calder. Thanks for inviting me. In terms of the question, I would rather focus more on the economic dimension, especially with the employment status. And I'll be reflecting on Bangladesh particularly based on the different surveys that were conducted during the COVID period by my institute and also other think tanks and other researchers. And the one thing that stands out here is the volatility of the employment status of unskilled workers, particularly in the informal sector, also in the formal sector, factory workers, transport workers, and so on, and whose employment status was particularly sensitive to economic lockdowns, and particularly with the works that are more characterized by informality and so on. Surveys have shown, and within those workers, that urban workers that I'm mentioning, there's a particular impact on the women, especially young women. And surveys have shown that almost a third of the female youth working prior to the pandemic did not manage to find jobs, even 7 months after the lockdown was lifted. So there is a particular dimension to that. And also, who could maintain their livelihoods during this period? I'm talking about the year of 2020, the beginning of lockdown, and also the early 2021. We continue to see the gender gap in terms of the effect of lockdown. For example, surveys have shown that roughly around 15% of during both periods, women, the reduction in the working hours of women in comparison to male counterparts, that the average reduction was only 1.5%. So there is, as you can see, a striking difference here in terms of impact, in terms of getting back jobs. Clearly a negative disproportionate impact was there of pandemic on women's income as well, consequently. And surveys also have shown that average income of women labor decreased by 38%. In terms of the business, small business, informal SMEs, although they started opening, they started functioning, but the recovery was still below pre-COVID 6 months after the lockdown. And this was particularly true for the female labor-intensive sectors, sectors with very high level of health risk. And my final point on this would be that although we have seen that when the economy started operating at a full capacity, but women had hard time, comparatively speaking, getting the job, because one reason particularly that stood out was that it was very difficult for women to switch their job, given the gender role in the job itself. Well, I think I'm being very quick compared to other panelists, and I'll stop here for the time being. Thank you.
Thank you. Fast, but also good. And I think what you've touched on is so important in terms of highlighting what the consequences of unequal gender norms around unpaid care and domestic work, the lack of social infrastructure, and what those impacts are on women and young women in particular in the Bangladesh context in terms of economic participation and economic empowerment. So I think those were those figures really drove things home for us and gave us some specifics. So very, very apt. Thank you for that. Let's look forward now. I know that all of us have been living in COVID for a long time and bemoaning, the terrible things that are happening, in the world and in the region, in the Indo-Pacific. But I want to look forward and talk about a brighter future and talk about the hard work that we have to do to tackle some of these the pre-existing inequalities that were exacerbated, as well as new risks and inequalities that have come to light. So what should we be focusing going forward? Focusing on going forward, I'll ask Dr. Datta, how can we work towards rebuilding and strengthening social infrastructure and social capital in Asian cities?
Thanks. That's something that we've been working on with these young women that I mentioned in my earlier conversation just now. So one of the suggestions we had was to particularly focus on the connectedness of infrastructures, because the lack or brokenness of this kind of networked connection leads to broken access, basically. So it's important to identify what are these survival infrastructures for particular social groups, as Dr. Munsi was talking about just now. Each group has different needs to infrastructure. For these young women, it's very, very important to access the internet. It's very important to access public buses. It's very important to access education. So they have very different needs, and that's a kind of a network of survival infrastructure that needs to be adhered to for them. For older women or for older men, it's different. And so in each space, in each time, there are different combinations of physical, social, and digital infrastructures that need to be provided. And physical infrastructure is huge and vast. There's water, sanitation, housing, public transport, all of that. And these are something that is not that's not just become important during the pandemic. It's always been important. But what the pandemic has shown is that when you are stuck in the home, lack of access, lack of existing access makes it worse. So we need to identify that, and we need to understand where and how to provide this in a way that will at least provide for lives and livelihoods to thrive and flourish. But also with that, communication is important. And so one of the things that we realized is it's not important to have a smartphone in order to communicate. We did our podcast workshops completely virtually with very low cost, low tech mobile phones, just by providing for mobile data. So I think we need to explore the possibility of low cost, low technology that will enable communication. And that will enable communication in a way that you don't need to be digitally literate or digitally savvy. And that would make it not just accessible to young women, but also make it accessible to elderly people, elderly women who really actually also struggled without that communication without the face-to-face communication that they are used to. So care, communication, low cost, low technology, and so on. The second point, I think, is actually was for us quite important, and that is to bridge the gap between two very important social institutions. One is the family, and second is the state. And sometimes, or well, actually for the poorer people, most times, the family and the state do not talk to each other. What do I mean by that? Well, the state does interfere in every aspect of family life, starting from marriage, custody, everything else, your sexuality. And yet it does not want to address simple, well, not simple, but important aspects of family life, like domestic violence, that's already been mentioned. It sort of keeps away from it. It doesn't understand the intimate nature of infrastructures and kind of intimate harm that broken infrastructures can do to women inside the family. And public policy, therefore, has a huge gap in addressing needs of family power dynamics or addressing the issues of family power dynamics. How do you educate men, boys, to understand menstrual issues for women, the kind of increased care work, increased exhaustion, increased labor that is, becomes problematic for them during those days of the month. They're not appreciative of that. So I think in your report, you've already highlighted that men need to be involved in it. We saw in some cases NGOs were very, very involved in educating and having these kind of workshops with men. How can you provide and how can you take care of the women in your family? How can you be sensitive to the roles that they perform? So I think there is a very important gap here in bridging the connection between the family and the state, which are the two most important social institutions for the most marginalized groups. And you see that also in terms of particular social groups, like, again, Dr. Munsi was talking about young women, yes, older women, yes, but what we saw, one of the most marginalized people during the pandemic were the transgender community. They are outside the family. They don't have a family. They can have the state, but they're not allowed to go out and work on the streets. There was no access. And at the same time, they need to hide from the state because the state criminalizes them. So we again need to understand these sort of intimate nature of impacts of infrastructure on particular social groups. And the last and final point I want to make, and I've said this already in my earlier presentation, is that we need to focus on smaller cities. The bigger cities need help, but I think the smaller cities are far more precarious in the way that everything collapses and everything broke down. So we need to focus on education, providing hospitals, public health care, public toilets, tenure security. It's not important to have a housing that you own, but even having tenure security, particularly for those renting in informal settlements, was very, very important in these smaller cities. So I think we really need to focus on providing basic physical infrastructure, improving basic physical infrastructure in smaller cities, but also thinking about how low cost, low technology can help people in smaller cities who are not digitally savvy in the same way as perhaps women in Delhi or Mumbai would be. So thinking about those sort of issues, and again, that interconnected nature of physical, social, and digital infrastructure, not allowing this brokenness to happen would, I think, go a long way in enabling more sustainable futures, particularly more sustainable feminist futures. Thanks.
Thank you so much. I love that you started and you ended on that bright spot about, this is it's not rocket science. You can use something very low tech and you can enable that connectivity, which is so critical. And I just loved your point as well about, the state as a patriarchal structure that controls women's bodies and women's lives, yet, consistently fails to meet their basic human rights. And some of the things that you touched on as well around, sort of like masculinities and engaging men and boys in that endeavor. And I think we should, it would be great if we could come back to that in the question period as well. Fantastic. Thank you so much. I'll move on to Mr. Musni. What are the key priorities now for ASEAN from your seat in the Secretariat in order to address deepening inequalities in cities? What's the top of your to-do list?
Thanks, Dr. Rebecca. There are three things I'd like to highlight when it comes to ASEAN's priorities, but to preface that with an explanation that ASEAN has continuously placed a high-level political commitment on promoting gender equality and empowerment of all women and girls. And it is using its convening power as well as leveraging partnership at the regional level to really push action at the national level and vice versa. So with that caveat, I think there are two main regional frameworks that ASEAN is working on right now that's relevant to our discussion. One is the ASEAN Comprehensive Recovery Framework, which is ASEAN's exit strategy to recover from the pandemic. And what is significant in this recovery framework is that it has embedded a gender perspective, a clear mandate to incorporate gender in recovery initiatives. So we see this most prominently in the broad strategies on human security, social protection, generating jobs and livelihoods that really targets women. On the other hand, currently ASEAN is in the process of implementing the ASEAN Gender Mainstreaming Strategic Framework. It is a whole of ASEAN policy that intends to integrate gender perspectives across the three ASEAN community pillars. So ASEAN, if you imagine ASEAN as a house, it has three foundations: the political security, economic community, and the sociocultural community. And within those foundations, we have a multitude of sectoral bodies, no? Looking at, for example, education, trade, services, customs. So with this gender mainstreaming strategic framework, the intention is to mainstream these gender perspectives, no, and really raise and highlight the gender dimensions of work of each of these sectoral bodies, no. So that's the first point I want to emphasize on the regional frameworks. Now, the second one is on data and evidence-based policy development, which is what we really need right now to respond effectively and recover from the pandemic. So what ASEAN has done so far in terms of prioritizing data generation is to develop studies. For example, we've released the ASEAN Gender Outlook, and we're now in the discussion on developing a new one, and the second iteration, to look at specific SDGs with the gender lens, no? And also, just this coming May, we're going to launch the policy brief on inequality, which looked into SDG 5 in relation to poverty, labor, education, and access to technology. So we hope that all of you can join us in this launch. And also, maybe just to emphasize this priority of ASEAN in generating data, I think in partnership with the Asia Foundation, we also undertook a rapid assessment of response to the COVID-19 pandemic, which really helped us a lot in locating women and other vulnerable groups in the whole response to the pandemic. Now, the last point I want to emphasize is on inclusive cities, no, which I think ties in well with our discussion. I think back in 2020, at the height of the pandemic, ASEAN was able to convene a series of webinars in partnership with the Asia Disability Forum and the SAO Foundation. So the Disability Forum, they work with a network of organizations of persons with disabilities, and the SAO Foundation, based in Singapore, they work with older women. So they look at gender and aging, no? And with this partnership, we looked into smart cities and also engaged local governments, local authorities. And really during those discussions, what came out is there's a willingness to address all of these issues, but the question is on how to do it. So I think the priority now that we're looking at in ASEAN is to really support government officials as they look into reforming, changing policies and programs, recalibrating them, but not just government officials, also facilitating stakeholder engagements, partnerships, no, with civil society organizations, members of the academe, and really using this whole of society approach to address these inequalities which have been exacerbated by the pandemic. So those are the three areas of priorities that ASEAN is engaging now, Dr. Rebecca. Thank you.
Thank you so much. And I'm really glad that you raised the Smart Cities Initiative, which I think is absolutely fantastic, and creating the space for dialogue between, local government, national government, civil society, the private sector, to come up with, sort of smart and inclusive solutions to some of these really sticky issues. So thank you for raising that, as well as the other two initiatives that you're working on as well. It sounds like the future is bright with ASEAN, so it's great to have that positive look forward. My last question is for Dr. Hassan again. What, in your perspective, what would it take to strengthen urban safety nets, particularly for those in informal or precarious work, which we've heard a lot about today? And how can such a type of reforms be designed and incentivized?
Yeah. Thank you. For me, this question should not be framed in terms of technocratic design or managerial design. Of course, they're important. You need to do that. But I would try to couch it in the context of broadly political economy, also in terms of state-society relations. Again, a reflection from Bangladesh. The striking thing about this urban reality, as well as rural reality too, in terms of poor people versus the state or the political society, is that the lack of collective capability, collective political capacity, collective action capacity in general, autonomous of the political society of the urban poor. That's a serious problem. And when a country also lacks in the political society, left-wing politics, which is true in Bangladesh, it's a severe weakness of left-wing political activism. So that's created a problem in terms of how urban safety nets should be designed. Because as I said earlier, I look at this kind of design principles in terms of state-society relationship. Otherwise, it becomes top-heavy. It becomes bureaucratized, manipulated, and controlled. That is happening in Bangladesh for decades. Also, need to focus on the nature of the state capacity in terms of its infrastructural capacity, in terms of its capacity to deliver services. And what I'm going to say, the lack of information processing capacity on the part of the state that created a lot of problems in terms of relief distribution, in terms of social protection, related delivery services, and so on. And another assumption that I'm going to make is that about social capital. I mean, that has been mentioned in the presentation. I don't see social capital, from the liberal framework, is a bit romanticized, homogeneous, and altruistic, people helping each other, and that's there are a bit of it, of course, especially in the rural areas, probably with the community and so on. But in the harsh urban reality, it's less so. It's more of patron clientelism that poor have to rely on to survive, and that has happened during the pandemic in Bangladesh in the major cities, and the patron being mostly coming from the city corporation, the political elites, the representatives, and so on, and it's less benevolent, and it's more transactional, and due to the deep power, deep asymmetry in the power relations between the state and society, particularly the urban poor. So with this assumption, I would like to mention some points in terms of urban safety nets design principles and incentives associated in relation to informal precarious workers, as the question suggested. The biggest problem in terms of design, particularly in Bangladesh, may be true for many other countries, is the lack of robust or even functional database of the urban poor, particularly in the informal sector. And in order to design such urban safety net for precarious worker, we need large-scale data and surveys, as well as in-depth qualitative research. So we can map the need of the people. And that created problem. People who are aware of Bangladesh situation would know that the government at one point wanted to go for a digital listing and so on, and that failed because of this infrastructural capacity, particularly in relation to the data management by the government, and something that the government has ignored for long. And another problem is that with the government policymakers and actors, the informal sector does not, is not in the mental horizon in most cases. They tend to be ignored. And that's connected also with the lack of collective action capability of the informal sector, especially in the urban area. So for a robust design, we need to focus on the demand side at the same time. Thinking of collective bargaining arrangement between the state and the the poor, what kind of intervention would be needed, what kind of supply of demand side actors will have to get involved in this, the civil society, the NGOs, and so on. Then for that, you need vigorous lobbying and advocacy from the civil society side, human rights organization, creating the demand for it. So that should be part of the design, that how do you bring in, and I'm here talking about a fundamental design principle, that is the focusing on the state society synergy, creating a third dimension. Other than that, given the governance reality that I mentioned at the beginning, the safety net program, given is the corruption, the leakages, the partisan selection of beneficiaries, and so on, the program must integrate the civil society, the community actors, in the creation of deliberative spaces, especially at the local government level. We do have that in our country, but they're mostly dysfunctional. So how do you invigorate those things? How do you revive or make it functional? That would be part of the design. So the collective political capacity of the urban poor can be generated, can be utilized, so that where state, civil society actor, and the urban poor can interact. It's the deliberative spaces that I mentioned in the local, lodged in the local government, different kind of committees, different kind of platform that the authority uses. They are more a bit functional in the rural areas, but in the urban areas they are almost non-existent. They exist in papers, of course. So in addition to this state society synergy, I think there has to be a focus on the capacity building, institutional, managerial capacity building of the urban local government, so they can run, so they can govern the urban safety net programs adequately. The last thing that I would like to say is that some form of social accountability mechanism must be made part of the design. So there is a constant monitoring, constant inputs coming from the citizens, from the beneficiaries themselves. So I'll stop here. Thank you.
Thank you so much. I like that you kept returning to the relationships within a really complex and challenging political economy within Bangladesh, and the relationships between sort of like different structures, different groups of people, and the need for that collaboration again, which is a little reflective of what Mr. Musni was talking about in terms of inclusive cities as well. So I think there's a theme. Here. Thank you so much for responding to those somewhat challenging questions. I asked you to encapsulate everything that you've learned and then solve all the problems that we've got going forward. And I think you spoke very eloquently to those questions. We've got some questions that have come in now from participants. And I think maybe one that pick up for Mr. Hassan again. You talked about clientelism as a important form of social capital, and not always a completely benevolent, definitely not an egalitarian form of sort of reciprocal social capital. And I'm wondering if we see that clientelism has failed when you look at the exodus of so many people from urban areas to rural areas during the pandemic. One of our participants says it's quite curious that we saw a rise in urban to rural migration in Bangladesh during the pandemic. Usually the migration moves the opposite way. What's happening here? And I wonder if it does relate to that sort of vertical social capital, that clientelism just being a weaker form, or whether it's insufficient horizontal capital when people all experience a shock together. It's very, it's not an asynchronous shock. It's a covariate shock that the whole population is experiencing. So I'm wondering if you can speak to that, any of our panelists, but I'll see if Dr. Hassan would like to respond first.
Okay, I'll take that up and answer it very briefly. Well, you don't have to do serious research in this area. People moved out. People who were in Bangladesh, they come to the urban area for job, and when the job is missing during the lockdown, and it is difficult to survive in the rural areas. Sorry, in the urban areas, paying rents and for livelihood and so on. So they had at initial stage they moved out. They went back to the rural community, much more benevolent, where safety net, de facto safety net is there in terms of community providing the services, taking care of the people. And so lots of people had to go there for that kind of comfort zone for the time being. With that also happened with the RMG workers. They moved out too, and wanted to stay there for some time, but a lot of things happened in Bangladesh. They were called back, and a lot of harassments and so on. But in general, I would say people, it's not a paradoxical thing that people will go back to the rural area. They had to, because there was nothing that they couldn't survive at that stage in the urban area. They had to go back and sought the comfort of the rural community, more benevolent and so on, and less harsher than the urban reality, where it is, well, patron clientelism is still in the rural areas, but that patron clientelism is much more benevolent compared to the urban area, much more personal, less impersonal, like the urban area, and so on. I think so the people took advantage of that, if you like.
Yeah.
Okay, thank you.
Thank you. Dr. Datta, Mr. Musni, anything that you'd like to pick up on, or any additions that you weren't able to, something more that you would have liked to have said if I've given you 6 minutes rather than 5?
Nothing much more to add to that, but just to agree that it's certainly we saw a reversal of the migrant population. One other thing I'd like to add, though, is clientelism is probably not enough to explain why people stay and why people go. It is certainly one of the factors, but I think one of the other factors is invisibility from the state. There was a large population that was invisible, actually, and they had no connection to the state. And in fact, maybe going back to one of the points you made earlier about smart cities, I mean, I've been doing a lot of research in smart cities, and one of the challenges of smart cities is to make it low tech. It's actually too high tech, because the big global corporations, Cisco and IBM, are involved, and everything becomes high tech. And we saw this in the pandemic, that one of the first state interventions was to turn the command and control centers that had been set up in the smart cities into COVID war rooms. What that meant was that they were able to track these mobile phones and who was coming in contact with each other. But what they didn't realize is that almost the entirety of the migrant population didn't have those smartphones. So they didn't even know who this migrant population are. They didn't know anyway how to contact them. It was only when civil society stepped in, these NGOs stepped in, the computer engineers who were doing voluntary work stepped in, that they began even to compile WhatsApp lists of mobile phone numbers of migrant workers, and even think about trying to help send them relief, send them railway tickets to go back to their rural neighborhoods. So I think we have to be very, very cautious when we suggest technology or smart cities, particularly as a solution. I think we really need to think about smart cities from the bottom up in terms of what were really frugal, low-cost solutions that were improvised by civil society rather than what was provided by the state, in immediately making partnerships with IBM, spending whole loads of money in these command and control centers, when that money could have been spent in public health, providing cylinders. So I think we have to be really careful about thinking about technology as, a solution. I think technology can address some of the symptoms, but it's never a solution. It has to be there with very robust public policy.
I love that message, smart enough, or smart but not too smart. I think that's very wise. And I know you've been doing a lot of research in this, so you have like loads of great examples and speak from sort of a strong background in this area. So words that we'll definitely take to heart. Mr. Musni, anything you'd like to add to that?
Yeah, thank you, Dr. Rebecca. I'd just like to pick up one point I saw in the chat box from our friend from the Philippines regarding studies that appear like there's too much focus on women and not enough on men. This really speaks to me because as an ally, I think we need to address and clarify this. No, first of all, based on what we have experienced in the ASEAN region in terms of data generation, I think most studies, researches are undertaken with the design of looking at both men and women. So for example, if national government agencies undertake time use surveys rather, to look at the productive and reproductive roles fulfilled by men and women, the roles are really seen there, the number of hours used by men and women on specific duties. So there's a comparison, and there's like a detection of what they do. So it exists, and also the simple sex disaggregation of data. So we see it's there at the foundational level. Now second, so after going through these researches, what do we see in terms of the men? Earlier I mentioned that in the ASEAN region, women outlive their male counterparts. So it looks like we're dying early. No, we're not dying early in the region. It just means that it has a lot of implications from the health perspective. It might mean that there's a rise in non-communicable diseases or lifestyle induced diseases among men. So that's one way of looking at it. But in relation, for example, to child early forced marriage, we see that there's an increasing trend of, or rather an increasing number of young boys and young men being engaged in early marriage because of issues on sexual reproductive health. So again, the data is there. The way to look at the data is there. So I think that the third point I want to emphasize is that this whole discourse and discussion is not about pitting men against women or vice versa. It's about men and boys being engaged in this whole advocacy for gender equality. And in the ASEAN region, we have launched a couple of years ago the ASEAN He for She campaign, wherein one part of this campaign is to identify male gender champions and allies to really advocate for gender equality, and also to translate that kind of championing sort of at every level. So we see that there is really a huge role for men and boys to be engaged in this conversation on gender equality and empowerment of all women and girls. Thank you.
Thank you. That was the question I was going to come to next. So you've jumped the gun on that, and that was such a wonderful response. And the point that the structures which disadvantage women also disadvantage the majority of men who are not wealthy, and those who are not in dominant ethnic groups, and those who don't have privilege one way or another. So it behooves the 99% of us, who these structures disadvantage in some way, to recognize that. And I think that a couple of people have talked about sort of like the collective. I know Dr. Hassan also talked about, that just aren't the movements around informal workers. They're not collectivizing and aggregating, and coming together to demand their rights in the same ways. And so I think that's a salient lesson. I think we might only have the chance for one more question. We did get a question here that somebody who was really interested, Dr. Datta, on your point between the connection or lack of connection between the state and the household. and would love to hear more on whether there are any sort of particular policy interventions or programmatic interventions that you've seen that has helped to bridge that gap.
Thanks. Very briefly, it's a selective connection, I would say, between the state and the family. The state likes to intervene in all sorts of intimate affairs of the family when it's not necessary, like, what sexuality, what kind of marriage laws should you have, whether you should be married or not, whether you can get a housing if you're married, etc., etc. So it does regulate in very intimate aspects of family life, and at the same time says, oh, it's not our problem, when there are other aspects that are actually very inherently disadvantages for women or minority communities. So there is that element of, I think, selective connection, which I was actually speaking about. And in the pandemic, you saw that domestic violence was a major issue. Differential access to care infrastructures or care roles was a very important issue. And I don't think the solution is necessarily being able to make these economically viable. I mean, don't get me wrong, of course, women should be paid for the care work that they're doing, for the kind of housing. It should be recognized as equally valid as any other economically productive role. But at the same time, it cannot be reduced to economics per se, because the kind of work that women did, they weren't doing it because they were or were not getting paid. I mean, a lot of this was because they were inherently led to believe that this was their role in the family. So I think the state can intervene in, number one, making men much more aware. And thankfully, Mr. Munsi has already talked about that in greater detail. I think state can play a far bigger role in empowering women or addressing the disadvantageous gender power dynamics within the home. One of this is, of course, through education, family law, improving family law to not make it disadvantageous for women to rent a property, to be single women, to provide education or to access education, but also in a kind of a bigger sense to be able to participate, leave the home and participate in kind of wider civil society. And those sort of pathways we don't yet see in public policy. It somehow assumes that women, need to become economically productive, step out into the public realm, but it does not enable those pathways from the home to the public realm for women. So those who come out and are engaged in economic productivity either are hugely marginalized in the public realm because they are not able to negotiate those power dynamics in the home. But also perhaps they're also hugely marginalized within the home just because they have taken the decision to step out. And it also relates to reproductive rights. It relates to all of those issues. So I think there has to be kind of a kind of holistic or a connected, again, a public policy that enables a pathway from the home to the public realm. And actually, some people might not even want to enter the public realm, but be empowered within the home. And part of this is enabling education, kind of sensitive education, sensitization of men and boys in order to address this gender power dynamics, but also sensitization in wider, public institutions like the police. In India, if you go to the police, and it really depends on how the police sees you as, which kind of family of you belong to as a woman, whether you're deserving or you're undeserving, and there's a lot of victim shaming. So sensitizing public institutions like the police force would be very important in sort of bridging the gap again between the home and the state. So I'll leave it at that. I mean, there are so many different ways you can think of this.
Thank you so much, Dr. Datta. And just one thing as well is it's about enabling those pathways from the public realm to the home for men as well. For example, right. through parental leave, paternity leave, things like that, state policies that really encourage men in caring, as well as sort of wider norm shift interventions, which, as you say, start very much in school or even pre that. Thank you so much. I feel like I've got enough energy now, even though it's 9:30 p.m. where I am here in Vancouver. I feel like I've got enough energy to keep on going, but I won't subject anyone on the webinar to that. I know we all have busy lives. I'd like at this point to just thank you so much again to our three brilliant panelists, Dr. Datta, Mr. Musni, and Dr. Hassan. And I'd like to hand back to our wonderful host, Faisal. Thank you.
Thank you, Dr. Calder. And we are just about, we are actually over the time allocated for this wonderful, I also wish we could continue on. Maybe we can have another version of this and continue discussing. But for today, I think we need to say goodbye and thanks to everyone. Just before leaving, I think Miranda will copy a link to the, share her email address if you're interested in the individual country report and the report itself. So there'll be individual country reports, since we have learned there's a lot of complexity and there's a lot of heterogeneity in all the country and all the problems and issues. So you can have a much more deeper look in each country and see that this is just the start of a long-term research work and lots of agendas to be fixed. So with that, let me thank everyone, and especially Sumaya and Miranda for taking all this hard work to make this happen. So a big clap to both of you for this perfect arrangement and with all the difficulties that you faced. So thank you very much, and looking forward to meeting you again in some or other topic of discussion. Thank you very much.
Thank you.
Thank you, everyone.
Thanks, everyone. Bye.